Canada's premiers are in Ottawa, hoping the federal government finally agrees to increase healthcare funding. They've been pushing for it for years. Currently, the federal government transfers $45 billion to provinces. The premiers want Ottawa to up its share of the Canada Health transfer from 22% to 35%, an increase of $28 billion.
What we really want is for the federal government to participate financially as a full and fair funding partner in those investments this year and for years into the future, beyond the 10 years even that have been discussed.
Ottawa has said it pays more than the 22% and argues that tax points transferred to provinces in 1977 make their share closer to 38%. Still, sources tell CBC News that on Tuesday, Prime Minister Justin Trudeau will propose a 10-year funding agreement. The Finance Minister wouldn't divulge any details today.
I am certainly not going to steal the Prime Minister's thunder ahead of that meeting.
Saskatchewan Premier Scott Moe and his colleagues have called for the money to come without strings attached. Moe says the provinces should decide how to spend it, and the money could be used to reduce surgical wait times and to help with mental health and addictions.
We don't know what's being offered yet, and so we're going to wait until tomorrow and look at what the federal government, the Prime Minister, is offering the provinces. But as I say, I think our priorities are likely closer aligned than what people realize.
A Saskatoon family doctor wants additional funding to be tied to improving primary care.
That's where I'm watching the meeting that's happening tomorrow between the premiers and the Prime Minister with sort of bated breath that, there is some sort of a large infusion of money to the provinces with the caveat that you need to reform primary care and ensure that people have access to the system in that manner.
The doctor says too many people are without a family doctor, which creates a burden on urgent care and emergency medicine. He says without a rethinking of how primary care is funded, the system won't improve. Adam Hunter, CBC News, Regina.